Hi, I'm Jordan Klebanoff. I'm an OBGYN resident at Christiana Hospital, and welcome to this week's episode of Pocket Pearls. Welcome to this week's episode of Pocket Pearls. I'm Dr. Jordan Klebanoff. I'm here with my colleagues, Dr. Chelsea Kibido and Dr. Tony Paserno, and we're going to talk about giving azithromycin at the time of C-section. C-section is associated with a rate of surgical site infection that's about 5 to 10 times higher than that of vaginal delivery. And postoperative surgical site infections affect about 12% of non-elective cesarean sections. So we're going to talk a little bit about giving azithromycin to help decrease those risks.
So why are we now adding azithromycin to non-elective cesarean sections?
In September 2016, there was a randomized control trial in the New England Journal. There's about 14 different centers, and they found a 50% reduction in both endometritis and wound infections 6 weeks out from surgery. They randomized women to either receiving standard pre-incision antibiotics and azithromycin versus women with standard pre-incision biotics and placebo. And the group that received azithromycin had the 50% reduction.
Who was included in this study?
Women were included if they were greater than or equal to 24 weeks gestation and were undergoing a non-elective cesarean section, either during labor or at least 4 hours after membrane rupture, regardless of when labor had started.
What was the dose of azithromycin used in the study?
It was just a one-time dose of 500 milligrams IV.
When was the dose of antibiotics given?
They were given either pre-incision or as soon as possible after incision.
Are there any important limitations to the study?
There are. So this study excluded women that were having either scheduled C-sections or had a diagnosis of chorio. So the findings aren't applicable to these groups of women that we commonly see. So to summarize the findings of this study in the New England Journal, giving women 500 milligrams IV of azithromycin if they're undergoing non-elective cesarean sections for either failed labor or if they have rupture of membranes for more than 4 hours, even if they're not in labor, showed about a 50% reduction in either endometritis or surgical wound infection within 6 weeks of their surgery.
The antibiotics were given either pre-incision or as soon after the surgery. What? How does it say?
It always says either pre-incision or as soon as possible thereafter.
Oh, I'm not going to say that.
The question.
Okay. Are there any important limitations to the study?
I guess I shouldn't ask.
That was the best